Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi, everyone. Welcome back to Falling Through the Cracks. Joining me today is Dr. Catherine Kurosu. She graduated from the University of Toronto School of Medicine in 1990. She co-authored the book True Wellness, How to Combine the Best of Western and Eastern Medicine for Optimum Health. And this is what we're discussing today. Catherine, welcome to the show.
Thank you very much.
So what inspired you to put this book together?
Well, actually, I can't take credit for the idea of writing this book. That goes to my co-author, Dr. Ihan Kuhn. Dr. Kuhn is a Chinese gynecologist who came to the United States and started practicing acupuncture and Oriental medicine. She was a Tai Chi and Qigong master already. So she opened her clinic in Massachusetts, and I met her when I was working in Massachusetts as also an obstetrician gynecologist. And she had already written several books on Chinese medicine, on Tai Chi and Qigong for our publisher, YMAA. And she had approached me about writing this book. She'd found a lot of people would ask her about how they could combine what they were supposed to do for their Western doctor with what she was offering in her clinic and in her school of Tai Chi.
So, the book is How to Combine the Best of Western and Eastern Medicine. So let's talk about what you mean by Western medicine.
Western medicine is considered to be the recent system compared to the ancient systems of Chinese medicine or Ayurvedic medicine. Western medicine has its roots all the way back to Hippocrates. However, as we currently know it, the Western system is really only developed about 200 or 300 years ago, where the idea of finding the initiating cause, the single most simple initiating cause of a disease, and treating that single cause is sort of the hallmark of what we know as Western medicine these days. In contrast, the roots of Western medicine going back to Hippocrates and various healers throughout the centuries. They viewed disease in a different way and looked for a multitude of solutions and problems within the individual person. Around the 17th and 18th century, that was sort of lost with the Industrial Revolution, and where people were looking for the one single linchpin cause of disease. So it's a different paradigm, a different way of looking at problem. And I think we're finding in Western medicine that, unfortunately, things are not that simple. And it's important to look at the whole person, the whole picture, the environment in which a person lives in order to find health solutions.
Well, so we all know what you're talking about. This is the medicine that we're using every day. This is our basic and first response to anything that is wrong in our bodies. We go to our family doctor. We get some testing done. What do you feel is wrong with this system?
Well, a lot of the times it's a matter of time and resources that the system has in terms of being able to take the time to tease out the underlying problems that a person is experiencing because of doctor shortages, particularly here in Hawaii. Primary care doctors are in short supply, and so they don't have very much time to spend with a patient and actually talk to them and find out what they're eating, how they're sleeping, what their stressors are, do they exercise, and how to get them to do all these healthful lifestyle activities in an effort to treat the root cause of the problem. It's easier and faster for a Western-trained physician to do a couple of tests, maybe write a couple of prescriptions, and send somebody on their way. They, unfortunately, even if they are that way inclined or want to spend the time to really dig out problem complex issues, they don't sometimes have the resources. And it's a matter of them changing the way they practice, but it's also the way they're taught. As Western physicians, we're taught to get to the single thing that you think will solve the problem and treat it with either drugs or surgery.
So, I practice Chinese medicine, and you study Western medicine, and now you're combining these two, from what I understand. But I know from the way that I look at things, when the first appointment, I spend over an hour with someone just going over a 15-page form that they filled out with all their symptoms and details. And for me, this is something that their doctor, just as you said, doesn't have the time for and really isn't trained for. And I'm sure that we've all experienced, if we have more than one problem, our doctor wants us to make more than one appointment. So if all these symptoms are actually stemming from the same root cause, the doctor may miss it because they're not looking at the whole, everything that's going on and considering the person in front of them. They're looking at the symptom and then trying to give a medication, which often is just covering up that symptom.
Yeah, that is correct, and that's one thing that I've found very striking when I look back at my career in Western medicine. I was a specialist, so family doctors would send people to me with a gynecologic problem, and often the patient, when they were seeing me, would start to mention, well, I also have this, and the next thing, and I would say, oh, well, that's not related to your gynecologic problem. You should go back and talk to your family physician. Now that I've studied Eastern medicine, I realize how wrong I was, and if I could only go back and revisit those patients, I'm sure I could have helped them a lot more than I did.
Well, that's exactly it. Like it's, I think a lot of people find very frustrating that we have our medicine compartmentalized the way it is, where, your family doctor is sort of this trunk and then you get branched out into these specialists. And like you said, if it's not to do with the one little area you look at, then you have to see a different specialist. And you could be seeing 5 specialists and maybe have 1 or 2 issues only, but everybody's dealing with only what they deal with, and then nobody's communicating properly, or I've seen people where the specialists disagree even on a diagnosis, which can be quite frustrating, right? And then what do you do?
Well, that's where I think that people are seeking what they used to call alternative medicine. Now is becoming more mainstream. They're looking for a system or a paradigm that can pull it all together and treat these seemingly unrelated symptoms and go back to basics. The body has this innate ability to heal itself if given half a chance, and it's up to whatever physician a person sees to realize that and encourage the patient to make these changes to allow that healing to occur.
So can you just explain to us a little bit about what Eastern medicine is?
Eastern medicine has become a phrase that was associated previously with terms of Oriental medicine or Chinese medicine. It seems separate than the term for Ayurvedic medicine, which arose in India, but is also related to Eastern medicine in the Chinese medicine sense. It's millennia old, and the oldest known documentation of it is from about 2000 BCE, and it's been really tried and true. The use of acupuncture is documented at that time, but one of the main tenets of Eastern medicine, as you know, is similar to the idea within Western medicine in Hippocrates' time, which is that the body can heal itself if given, healthy food, enough rest, sufficient activity, and some sort of contemplative practice like yoga or Tai Chi or Qigong and meditation. So given those four constituents, it's possible to let the body heal itself as much as possible. And I'm not saying that there's no place for Western medicine. Certainly anybody who's in a car accident or breaks a hip or needs a cesarean section, they would certainly want to be able to use all the beneficial techniques that Western medicine can supply. But I think that it's important to integrate the tenets of Eastern medicine along with the really technical wonders that Western medicine can afford us.
Well, from my point of view, I see a value in both systems. Testing is often quite valuable, and sometimes medication is necessary, whether it's for long-term or temporary. But also, I think that a goal should also be to try to do as much as possible to not go on medication, especially when we're looking at metabolic syndrome, high cholesterol, and things like that can be prevented with diet and lifestyle. It seems like, this is very common, and doctors either don't have the tools or the time, it seems, to coach people on what to do. And so they're very insistent, and I see a lot of resistance to them when people either don't want to take, especially cholesterol medication, or they want to go off because they've made changes. And it's almost like this fear-based, well, your cholesterol won't change, when we know it's actually can be quite simple to turn that around with some diet and lifestyle changes. And so it just seems like they should be combined, and we should be looking at both and trying to prevent. I think medication and surgery should be last resorts, or medication a temporary resort while you work on the root cause to get you to a certain point.
Yeah, I do agree. But I do find also that a lot of patients would like to, or have been conditioned to, hand over the control of the situation to their physician, so that they are less willing to make the changes themselves, the lifestyle changes that could, change their cholesterol or reverse type 2 diabetes. And because Western physicians have so little time to encourage and cajole a patient to make these changes, the patients don't feel supported. Usually if it's a cholesterol issue, the doctor will say, okay, well, you've got 3 months to change your diet and your lifestyle. Off you go. Come back in 3 months with a lab test. But there's no infrastructure to actually take that patient by the hand and make those changes. It's a daunting thing.
Well, yeah, and it would make sense to me if we had even a program that if doctors don't have time to coach people, because they probably see this every day, and it can take time to help somebody change their diet, and it has to be personalized, and there could be a class that they get sent to, but it just seems, even if that is offered, it's not taken advantage of. And
I do agree.
People are left to their own devices, or not offered something that is there because either the doctor doesn't know or just doesn't want to bother, which is a failing, I think, and that's where you and I come in to help people in that aspect, to be able to change things in their lives so that they can find wellness just sometimes with simple changes that they didn't know was something they needed to do to help with their symptoms.
Agreed.
So we're going to take a quick break. We're talking today with Dr. Catherine Kurosu, and we're discussing her book, True Wellness, How to Combine the Best of Western and Eastern Medicine for Optimum Health. We'll be back shortly.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
Healthcare has been a major part of news stories today, with one thing that has been consistent: inconsistency. Both healthcare providers and patients have to work around and get used to a constantly changing set of rules and issues. Nurses have historically been left out of this decision-making. Listen to Once a Nurse, Always a Nurse, Exploring the World of Nursing with host Leanne Meyer. Health professionals, we invite you to share your ideas and experiences while listening to experts in various areas of nursing. Listen Mondays at 1 p.m. Eastern, 10 a.m. Pacific on Voice America Health and Wellness.
Everything is energy. It's all connected. Your energy can be seen as the foundation for your life and impacts all areas of living. Do you realize that your thoughts have the power to affect how you show up? Tune in for Healthy Energy with Margot, featuring host Margot Nielsen. Margot and her guests will show you that connecting to your energy is vital to your health, relationships, money, and more. Listen live every Monday at 12 noon Pacific Time, 3 p.m. Eastern Time on the Voice America Health and Wellness Channel.
Now you don't have to stay linked to your desktop or laptop. Take Voice America on the go and listen anywhere. Get our mobile app for iPhone, BlackBerry, or Android at the Apple iTunes App Store, BlackBerry App World, or Android Market.
Your life, your health, your network. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Dr. Catherine Kurosu, and we're discussing her book, True Wellness. So, Catherine, one thing, I'm sure that you've been asked a lot of questions about Eastern medicine, but a lot of people seem to think that it's just some sort of hokey-pokey thing. Now, is there research and studies behind, the herbs and acupuncture and the mechanism of Eastern medicine?
Yes. There's less and less resistance to acupuncture. Fewer and fewer people are looking at it as magic or voodoo or something that you have to believe in to get it to work. There's been a long-standing history of actual scientific research into acupuncture. Starting back about almost 100 years. These days there's a great push to finding out the actual mechanism of action of acupuncture and how mechanically it works in a human body. And I think that the more people understand how that works, the more accepting they are of the procedure. It's recently Dr. Helene Langevin, who is a Canadian medical doctor who has been working at Harvard, was recently appointed as the director for the National Center for Complementary and Integrative Health, which is one aspect of the NIH in the United States. And she is a medical doctor who also trained as a licensed acupuncturist. And she has been doing a lot of research characterizing the cellular and mechanical effects of acupuncture, showing how it works in the human body. So to be able to explain the details of that to a patient who comes in who maybe has some misgivings about the whole endeavor, they feel comforted, and they are more confident in the acupuncture, which, as you know, may help to improve their outcome.
So what is your, well, I guess first I want to ask you what made you decide to change from the Western model that you were following with gynecology into this direction?
Well, my first experience with acupuncture dated back to medical school when a surgeon came and gave a talk to our class about acupuncture. Now, this is back in like 1986, and it was interesting. It caught my attention, but it didn't really sink in until much later when I was practicing obstetrics. I came across a randomized controlled trial about how to use Eastern medicine, specifically burning a certain herb over a certain acupuncture point, which you know is called moxibustion, in order to turn a breech baby from bottom down to head down. And as an obstetrician, that would be a technique that I could use to take the place of actually physically, manually turning the baby. The physical, manual turning of the baby is something called external cephalic aversion, and it can be successful, but it has its risks, which include disrupting the placenta or stressing the baby, requiring an emergency cesarean section. So it was not it was not a favorite thing of mine to do, and so when I read this article, I decided to find an acupuncturist who would take my patients if they were interested, and decrease the number of times I would have to do external cephalic versions. I was fortunate to find Dr. Darcy Yent in San Diego, who was quite successful with this, and then I started to send her other patients that I'd sort of come to the end of the road with from a Western medical sense, and she was able to help them consistently.
Which, you know, I would say is amazing, although I've done that many times in my career. But it is actually quite neat because it's a very simple thing that you do, and you're not anywhere near the abdomen, and then the baby starts moving around and turns, and we've got this, you know, very it's not invasive, and it's very gentle and a lot safer. So did you take that and then just start to get very interested and decide to do that on your own?
Well, actually, Dr. Yent, she's also a naturopath and an acupuncturist, and she did at that time predominantly acupuncture, and we were talking about long-term goals and, you know, how long we would like to work, and I couldn't see working into my 70s and 80s as an obstetrician. It's just too physically demanding. And I mentioned that I had been thinking about maybe doing acupuncture, but I didn't see how I could put needles into patients. I didn't, you know, while they were awake. And she reminded me that I was a surgeon and that shouldn't be a problem. But getting over the idea of putting needles into people when they're not anesthetized, that was a little difficult for me initially. So Dr. Yent supervised me giving her an acupuncture treatment. She showed me where some points were, and to my surprise, you can actually feel them. They're readily hiding in plain sight. And she encouraged me to pursue acupuncture training.
So what does your practice look like now? Or are you still specializing in gynecology and doing acupuncture in that regard?
No, I stopped doing gynecology and obstetrics as a specialty about 5 years ago. My husband, who's in the military, retired, and we actually went sailing for a year and a bit with our daughter. And when I came back, I'd finished up my licensed acupuncture training. In the United States, first I trained as a medical acupuncturist in 2009. So I was using acupuncture in conjunction with my obstetrical practice and gynecology practice for about 5 years. So it dovetailed very nicely. So I was really, truly integrating the two. Then when I opened my practice in Hawaii, I had to complete a master's program and national board exams in order to practice in Hawaii specifically. I could not practice as a medical acupuncturist, which is a doctor who's had about 6 months of extra training in acupuncture. So when I opened my practice here, I did general practice as well as acupuncture, but in the last 18 months or so, I've been just exclusively doing acupuncture and Oriental medicine.
So what kind of feedback, I guess, have you had from your peers on the Western medicine side? Are they supportive of you making this change to something that I guess they could see as very different?
Yeah, I've actually been very surprised at how accepting people are of it. Particularly from 2009 to 2013, I was working in a military hospital. And initially, when I asked for acupuncture privileges, because you have to go through almost like a credentialing process, and the hospital has to allow you to incorporate this into your regular care. Initially they were curious, and they didn't really see the application in obstetrics. But by the time I left in 2013, they were upset that they weren't going to have an acupuncturist on staff there in their department, because they found it so helpful for so many things they hadn't considered.
Well, the reason why I ask is when I became involved in Chinese medicine 16 years ago, there was a little more resistance than there is now, it seems. I had a family doctor fire me because I got acupuncture. He fired me as a patient. And I had patients come in whose doctor would say the same thing. You can't get that done. And,
wow.
I don't hear stories like that anymore. I do more if people are choosing a more natural approach to, like supplements and herbs. But for acupuncture, they're often referred now. So there has been a big shift in the acceptance on that part, which is great because acupuncture has very little side effects and no contraindications with medication you're on or the illness that you have. So it's very safe for everybody.
Yeah, and I think that any doctor worth their salt is willing to do whatever's best for the patient. And more Western physicians are realizing that there is a lot that acupuncture can offer their patients. I get referrals from oncologists, sending their cancer patients for complications from chemotherapy or just for general well-being. I get referrals from orthopedic surgeons. I get referrals from general practitioners. Initially, people think, as doctors, they started only thinking about the musculoskeletal aspects of acupuncture, back pain, knee pain, neck pain. But more and more, they're starting to become educated about all the things that can be used for a lot of gastrointestinal problems. I still do a lot of obstetrics in terms of everything from infertility through first trimester, morning sickness, then carpal tunnel or back pain. I do childbirth preparation toward the end of the pregnancy and labor induction. So I'm still very much involved with obstetrics and as well as gynecology as well.
So what sort of differences in outcome do you see in your patients compared to what you used to do when you were doing Western medicine?
Well, one of the most interesting things I've found, and which really impacts the patient's overall well-being, is it seems that using acupuncture helps people make better lifestyle choices. It's as in contrast to me when I used to tell somebody, well, this is what you need to do to lose weight or exercise more, or yeah, you really should meditate, and send them out the door. If I treat them with acupuncture, their sense of well-being when they leave is such that they make better choices. They feel better to begin with because of the shift in their basically brain chemistry that occurs with acupuncture, and it decreases inflammation, so they're in less pain, and so they're feeling better, and so they think, well, maybe I should have a few more vegetables today, or I think I'll try to meditate for a few minutes, and all of those changes are more than additive. They help perpetuate the positive cycle that people can get into. And when they come back, let's say the next week for an acupuncture treatment, it just moves it along a little further, and it builds momentum. And so I've seen people make really significant lifestyle changes by incorporating acupuncture into their care, whereas they've tried all these things before but have never really been successful.
Which is very helpful, because sometimes people leave their doctor feeling, even if their doctor is caring and listening to them, if they get diagnosed with something or given a prescription, most people don't feel good about that. It's not a choice that people want to be on a pharmaceutical medication for the rest of their life, or even temporarily. There's side effects, and sometimes you have to take a medication for the side effects of the first medication. And to know that there's what you're seeing is so dramatically different. It's great to have that contrast, that you're seeing people experience an overall wellness and making different choices as well, which is a big deal.
Yeah, and it has to come from the patient in order to be sustainable. When talking to Dr. Yent, who's the naturopath and the acupuncturist, she told me that if she had to choose between one or the other, she would choose the acupuncture. With naturopathy, it's like being a Western allopathic general practitioner or family practitioner. To get people to make the changes they need to sustain their health is sometimes the hardest part, getting them over that inertia. And I think as acupuncturists, we have an advantage. We can shift their sense of well-being to the point where it's easier for them to take that first step. And just like the ancient Chinese saying, the longest journey does begin with the single step. It's just getting people to take it.
I definitely agree. And it can be very scary to take that first step, because you don't know what's on the other side. But it's something I think we all need to do.
Yes, absolutely. Myself included.
Yeah, all of us. We're going to take a quick break. We're talking today with Dr. Catherine Kurosu. We're discussing her book, True Wellness, and we'll be back shortly.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
Are you tired of the healthcare system only treating your symptoms and never addressing the root cause? Discover how integrative medicine can resolve health issues through dietary and lifestyle changes and the use of natural supplements. Increase your energy, memory, mood, immune system, sexuality, and more. Join Dr. Sunil Pai and Maureen Sutton to help you take back your health with natural, evidence-based solutions. Tune in every Monday at 1 p.m. Pacific Time and 4 p.m. Eastern Time on Voice America Health and Wellness Channel.
Addiction can affect our relationships, our families, our home, and work lives, but most importantly, ourselves. The recovery process can do wonders in the lives of people suffering from active addiction and also for those that love them. It's not just 12-step programs, but so much more. It's learning how to live life on life's terms. If you can relate to these issues or love someone who does, start with yourself. Start by tuning in to Miracles in Recovery with host Ray Lynch, Mondays at 8 p.m. Eastern Time, 5 p.m. Pacific Time on the Voice America Health and Wellness Channel. Hope is in your corner.
Have you become a member yet? Sign up now to become a member of Voice America. It's always free and easy. Plus, you get to take advantage of some great member benefits. Get unlimited access to millions of hours of on-demand content across all of our channels. Keep track of your favorite episodes, shows, and hosts in your own customizable library. Find out what shows you might be interested in based on your favorites. Plus, you get insider access with our newsletter. Membership gives you more. Sign up at voiceamerica.com and click register at the top right.
Opinions, options, answers. You're listening to Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Dr. Catherine Kurosu. We're discussing her book, True Wellness, How to Combine the Best of Western and Eastern Medicine for Optimum Health. Now, Catherine, I know some people will just say that acupuncture is just a placebo effect. Can you just explain to us what that is?
Well, the term placebo comes from the Latin. It means to please, and it's the idea that the doctor is giving the patient something that is inert, that actually has no medicinal value, but activates the patient's innate ability to heal. It's over time taken on a more derogatory meaning that it is a useless thing. But in fact, when you look at randomized control trials that employ different arms and study groups, if they have a group that receives a placebo, which is something that is inert, they find in the placebo group that quite a number of patients actually improve in terms of their symptom profile, whether that's pain or gastrointestinal problems, whatever the study is addressing. So when people talk about testing drugs or testing procedures to find out if they're effective, they test them against a placebo group, so that the study group has to show a significant difference, a significant improvement beyond what one can get with a placebo. Now, recently, in the New York Times, there was an article examining the placebo effect and what that really actually is in biologically, and it seems that there may be certain enzymes and genes that are associated with a person's innate ability to heal. And what a placebo effect would be is to give that person whatever it takes to turn on that biological mechanism. And some people are in some people that occurs more easily than in others. So to say something is just placebo is sort of derogatory. If anything we do can turn on that system, then that, to me, is effective medicine, because the whole goal is to get the person to heal. So while there's definitely specific mechanisms that occur with acupuncture that involve sending neurological signals to the brain to activate certain biochemical processes, there is always in any medical endeavor the effect of the patient feels about the person who's actually administering the medication or the procedure, how they feel about the clinic that they're in, the trust that they have in the technique that's being employed. All of these things have been demonstrated to play into how easily this internal healing system can turn on.
Which you and I know can be quite amazing, how this can affect people.
Yeah, definitely.
So when we're looking at, your book is How to Combine the Best of Eastern and Western Medicine. So what should people do to take advantage of both systems?
Well, I think it's important to include the Western physician in the whole process. I think gone are the days of an antagonistic approach between acupuncturists and allopathic physicians, and it's kind of, I think, important for there to be a quarterback in terms of the healing system that's involved. So I would encourage patients to discuss this with their physician and get hopefully recommendations from their physician for acupuncturists that they trust, and discuss the utility of should they try acupuncture, or maybe Ayurvedic medicine would be better for them. But a lot of doctors recognize that they don't have the time or the expertise to themselves to use these approaches, but they're helpful for the patient. And particularly with patients where the doctor has not been able to satisfactorily remedy the problem, sometimes it's a difficult conversation. But those sorts of situations, the doctor is really quite grateful that there's somebody that they can send this patient to that they can actually be helped. I've had a number of referrals from doctors who have had patients where they don't know what else to do for this patient. Just like I was in that position before sending my patients to the acupuncturist I found in San Diego. It's quite a relief to be able to say to a patient, well, I can't help you with this, but I know somebody who can. And then I also look good because I've helped solve this patient's problem. So I don't think people should be afraid to discuss all this with their physician. If they have found an acupuncturist, an herbalist on their own and are seeing them, it's important to let your doctor know that you're doing that, particularly if you're taking herbal formulas, because there can be interactions between Western medications and herbal formulas, either Western or Eastern herbs. So that's a really important thing to do as a patient.
So, it's, I think, important for us to do this. Like, as we discussed earlier, doctors aren't always trained, especially, in the diet and the lifestyle, or just a different approach to what's in, the symptoms or the disease in front of them. And especially if we're dealing with a chronic disease, often people are going to continue to suffer even with medication. And you and I know that even just with acupuncture, you can get a lot of relief for pain or depression or just whatever is going on, and it won't interfere with your medication, and it's very gentle on the body.
Yeah, and just the fact that people can get some relief, even if some people's pain or depression can't be completely cured, if they're able to get some relief, it does change their whole attitude, their whole outlook, and change the way they take care of themselves. And so it does help, again, initiate this positive cycle.
So when somebody's coming to see you for this, what what process do you go through? Like, do you assess their lifestyle and recommend certain changes for them?
When somebody comes to see me, it's almost like they're seeing a regular Western physician initially, because I do a whole history and physical that's appropriate to the reason they're there. I talk about go into all their medical and surgical background, and then ask about things like their sleep and their digestion that often Western physicians don't. So my intake is an hour and a half for the same reason, and the patients are surprised that it's in such detail. But when I get all that information, then I'm better able to recommend changes to diet and lifestyle. But I start them off with like really simple things, just to set them up with, for success. So I give them homework, so that 1 week it may be just to eat 2 more servings of vegetables every day that you can, and or I teach them a simple breathing exercise that will help them start to meditate, and so they have concrete things that they can do that are not onerous and that don't have to be implemented all at once. So people in general seem to do these endeavors and make these changes when somebody is expecting them to. So if they feel like, next week I'm going to ask them about their homework, they're more inclined to actually do what they're supposed to be doing. So it helps them take that first step.
So, I mean, this is something I've never had a doctor ask me about, eating vegetables or even recommend it. And I used to have a lot of health problems with chronic Lyme, and I think that's the difference with this system. Spending over an hour with somebody and going through their lifestyle, when maybe there is something simple that they can change to help with their symptoms that. Can make their life easier. I mean, they may not need medication, but they might be uncomfortable, and they might need to make some changes to be more comfortable.
Yeah, no, that's definitely true. I think there's really no substitute for time, and part of it too is people need to tell their story, and I don't think they get a chance to very often with. Western physicians, because Western physicians are so pressed for time, but even that act of telling their story, how did they get to this place, and feeling understood by the person who's listening is very therapeutic. I think that's a big part of what we do.
I agree. I tell people that all the time, that, part of healing is having yourself heard. And especially, if you've been, if your doctor doesn't have time for you, like, they're on the I'm in a hurry side. And then your life is on hold because of what you're going through, and nobody's hearing you. It can be very frustrating. And I think some people, get really depressed by that. One of the questions I ask people is, are you experiencing depression because it's there, or because of what you've been going through with this, which is a whole different thing. You're depressed because your doctor's not listening to you and helping you, and you can't get help for what you're going through, is different than the depression causing your symptoms to start with.
That's right.
So one thing that comes up in the difference between Western and Eastern medicine is prevention. These are a whole different ball game, because in the world of Western medicine, from what I gather and understand, is that they're preventing a disease from getting worse. And how is the Eastern approach for that?
The Eastern approach it focuses a great deal on prevention. One of the things that I discovered with studying acupuncture was acupuncture and herbs are considered like the last resort of a good physician. A physician would be treating the patient by encouraging them to eat certain things, maybe at certain times of the year, or exercise in a certain way, get enough sleep, which is huge. And the more we discover about sleep physiology, the more we know that as a society we get way too little sleep, and it's significantly contributing to all the diseases, the cardiac diseases and the hormonal problems and depression and anxiety. So getting sleep is one of the most important things that people can do for themselves. And all of these things taken together will help prevent disease. In ancient times, apparently a physician was paid to keep somebody well, and you wouldn't pay your doctor if you got sick because they failed you. So it's a complete reversal these days, where doctors are paid to treat illness. It's like people have likened it to, it's not a healthcare system, it's a disease management system. So to shift the whole medical system to one of disease prevention, it's possible, but it needs to be a united effort between not just the doctors, but everybody, the acupuncturists, the massage therapists, the chiropractors. Everybody has to get on the same page. But the most important component of that are the patients. Somehow we have to encourage them and get them to do what needs to be done. We can't eat the vegetables for them. We can't go to sleep earlier for them, or take them for a walk every day. So the community needs to be making this easier for everybody to do the correct thing for their health.
Well, I definitely agree. I want to thank you so much for joining me today. Now, if somebody wants more information, is there a way they can get a hold of you or your book?
Yeah, they could email me. My email address is catherinemdacupuncture@gmail.com. That is CatherineMDAcupuncture@gmail.com. My website is, again, CatherineMDAcupuncture.com. And my book is available through Indigo in Canada, Amazon, Barnes & Noble, as well as on my website.
Well, perfect. Thank you so much for joining me today.
Oh, thank you for having me. It was a real pleasure.
And if anybody wants more information about my journey back to health, you can see that on my blog site at dr-risk.com. Don't forget to follow me on Facebook, Twitter, Instagram, and LinkedIn, or your favorite social media website. Thank you so much for listening today. Be sure to make today a great day.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness channel. We'll talk more next week.